You are watching UNICEF television. Mariam Musa has been in labour for 6 hours and is bleeding heavily. She's bundled into an ambulance and rushed to the main hospital in Boroma, a town in Somaliland. The midwives keep a close eye on her blood pressure as the hospital prepares for an emergency caesarean. The new ambulance and upgraded facilities at the hospital help ensure that Mariam's baby, her 8th, will be delivered safely, despite the complications which are all too common here.
Bleeding is the most common and serious problem we see with women who come here to this health clinic. The community still thinks it's normal. They don't see it's a problem unless the woman dies. Most women have been circumcised and this complicates delivery and a lot of bleeding occurs.
At Dilla Maternal and Child Health Centre, or MCH, outside Boroma, Fadio Isak, a mother of 4, is about to give birth. Although she delivered her other children at home, health workers warn this last pregnancy has put her life in danger. She was brought to the health centre after spending 3 days in labour at home.
During my pregnancy, I almost died from excessive bleeding. So this time, I decided to come to the clinic to get medical attention. Now, I already see that giving birth in the hospital is better. You can see the midwives have been checking me all the time.
The number of women giving birth at Dilla Health Centre has shot up in the past 2 years. This is thanks to ongoing work by UNICEF and its partners, supported by the European Union, upgrading maternal child health centres in Somaliland and Puntland, and providing them and local referral hospitals with basic emergency obstetric and neonatal care facilities. Many health centres are open round the clock and now have solar power and running water.
Previously, the maternal mortality rate was so high, and in our MCHs, there were no delivery system at the MCHs. But when Somali reproductive health has started, sexual reproductive health has started in these 7 MCHs, the delivery, all normal delivery was conducted at the MCHs. Previously, there was no delivery at the MCHs, but currently the number of deliveries at the MCHs has increased.
The project includes a large training component, with courses for doctors, qualified nurses and midwives, and community health workers. Traditional birth attendants are involved, persuading women to come to health centres or hospitals for antenatal checkups and to give birth. One such attendant, Ada Mehile, used to walk long distances to help women giving birth at home. Despite 30 years of experience, she says there were times when she could only watch as women died during labour. But this has now changed.
We did not know what used to cause problems when women were giving birth. When bleeding started, we did not know what to do. We did not have anybody to assist us if things went wrong. Most husbands are too poor, they cannot even afford transport. It was hard to get help and sometimes the woman would die. But now the cost of transport is covered, everything is covered.
Having a baby poses one of the greatest risks to the lives of Somali women. In Somaliland, fewer than half of women giving birth have any kind of skilled personnel with them, and in the rural areas, the numbers are much lower. The babies also suffer, with newborn deaths commonly due to low birth weight, premature birth, asphyxia, birth injuries, septicemia and neonatal tetanus. It's estimated that more than 22,000 mothers and newborns will be helped by the 3-year-long EU-funded programme. One such beneficiary is 28-year-old Layla Dahir, who's just given birth to her first child. Her new son Adam has no idea, but by giving birth here at the health centre, Layla has given him the best possible start in life that she could. This is Susanna Price reporting for UNICEF. For more information, go to www.unicef.org. Unite for Children.